For those of you who are new to the series, I'm Aviva Sapers, CEO of Sapers and Wallach, a full-service employee benefits and financial advisory firm. I'm joined by my colleague and friend Holly Knight, who's our Director of Retirement Outcomes. Before we dive into this complex topic, I want to go over a few housekeeping items. The webinar will be recorded and will be available for viewing shortly after we're finished today. We will send around a link. It'll also include a link to our prior sessions if you want to see what you missed or if you just want a refresher. For today, I'd remind you to click on speaker view to best see us and the slides that we'll share. If you have any questions during the presentation, please put them in the chat and we'll try and answer as many as we can. Once we're finished with the formal presentation, we'll turn the recording off and continue with an informal half-hour fireside chat where we will open the floor to any questions that you may have. Note that neither Holly nor I are licensed Social Security experts, and the information provided today is meant to be an overview of the Social Security and Medicare systems and what potential scenarios may be applicable to you. If you have a question, if we don't know the answer to, we will tap our expert partners and get back to you with the answers you seek. Likewise, if you want to schedule time to discuss your own situation with either Holly or me, you'll receive our contact information at the end, and we would encourage you to schedule a time to meet. Finally, following this, when we send out the link to you with all of this information and our resources, you'll be getting a survey to complete. I know surveys are a pain, we'll keep it short, but we'd really appreciate you taking a few minutes to complete a short evaluation of this session and the series in whole, so that we can continue to provide education of value to you. You're important to us, and your feedback is the best way for us to continue to improve. So today we are here to talk about the hot topic of Social Security and Medicare. According to the Social Security Administration, the number of Americans aged 65 and older will increase from approximately 56 million today to over 78 million by 2035. Most workers approaching retirement age understand the longer they wait to collect their Social Security benefits, the greater the monthly benefit will be. Though the longer you wait, the more you get is true, it is rarely, if ever, the only factor affecting you when you should begin your Social Security benefits. Other factors include life expectancy, relationship status like single, married, divorced, widowed, remarried, minor or adult disabled children, collecting certain types of pensions, continuing to work while collecting benefits, disability, and more. Because of the number of Social Security rules and the complex nature of the benefit calculation, most people do not know what questions to ask. Couples especially may not understand the sheer number of possible claiming strategies between them that are possible. So we'll begin today's session with a quick assessment of your knowledge of Social Security. Whether you're single, divorced, married, or widowed, these questions are fundamental, and learning the answers will help you know your options when the time comes. Let's go to the poll.
All right. Does everyone see the poll? Thumbs up. Thumbs up. All right. So question 1, at what age would you receive the maximum benefit from initiating Social Security? Your choices are 62, 66, or 67, depending on what your full retirement age is, 70 or 72. That's question 1.
Holly, I don't see the poll.
You don't see the poll?
No.
Does anybody see the poll?
No, I don't see it either.
There are some people who are answering the poll. I'm watching it. So are you looking at more than one screen?
No, I just see Sapers and Wallach.
Me too.
That's interesting. Not sure why that is. Okay, well, so we might have to do this poll at the end. I might have one of our little experts in the background kind of take a look at this. But so we can move on from this, Aviva, but we'll do this at the end. I'm not sure why it's not working. It was working fine earlier, but.
Should we be in a different view format?
You should be in speaker view. You should be able to see it in speaker view or gallery. I mean, you can funnel through both of those, but either one, it should work. I'm not sure why you're not seeing it. All right. Moving on.
We can move on.
All right, there you go.
We'll get back to the answers as well. I mean, the questions and the answers, because they're good questions to make sure you have. So today we're going to review the steps that you need to take to be confident that you're on the right path. Our program today is going to cover the basics of Social Security, benefit payout scenarios, the basics of Medicare, and we'll summarize that and open it for questions and answers. Sound good?
Sounds good to me. All right. So since 1935, American workers have been counting on Social Security as a future source of income. This important benefit has had many changes throughout the years, as we all know, but the basis of how it works has remained relatively the same. Social Security's trust fund is primarily funded from the taxation of wages earned by the current workforce, and then these funds are then used to pay out benefits to the program's beneficiaries. As you can see here, 1,543, that is the average monthly benefit reported in 2021. Now, the amount of your benefit is determined from averaging your highest 35 years of salary, regardless of the year when the salary was earned. So if you don't have 35 years of employment history, then zeros are used to fill in the gap of any of those missing years. So that's kind of important to understand. It's averaging the highest 35 years, okay? So the calculation of your benefit is really complex, as I'm sure you can imagine. So it's really best to review the amounts given to you by the SSA or the Social Security Administration. One of the things that we hope you take away from today is that if you have not accessed your Social Security statement online, we would encourage you to do so. You can go to ssa.gov, and it takes about 3 to 4 minutes to get on there and register, and then you'll have access to your Social Security statement. So, you know, this is worth noting. A lot of folks used to get the statements in the mail, and there is a small percentage of folks who still do, but they stopped doing that about 11 years ago, sending out those statements. So if you have not, you know, if you're 60 years or younger and you haven't received a statement and haven't gone online, you may not know what the SSA has for you as far as what they are projecting you to have for Social Security. So it's a really important piece to kind of think about, especially when we're talking about the integration of, you know, Social Security, Medicare, retirement planning, things like that. So ssa.gov, it's worth spending 3 or 4 minutes just to see what that looks like.
If you've ever seen your Social Security statement, then this should look familiar. It shows your projected benefit at normal retirement, at early retirement, or waiting to age 70. Can you guys see what's on the screen, or is it too small for you? You can? Okay, good. In addition, it also provides the details on disability, survivorship, Medicare benefits that you are or will be eligible for.
So I'm sure it isn't surprising, but few Americans understand the benefits and then the trade-offs related to claiming Social Security at different points in your life. So before we walk through what that looks like, it's probably helpful to understand what FRA means. This is an acronym that you'll hear quite a bit of. FRA stands for Full Retirement Age, which, as you probably know by now, is different depending on what year you were born. The Social Security Amendments Act of 1983, they increased the FRA from 65 to 67 over a 40-year period, okay? The first phase of that transition increased for individuals turning 62 between 2000 and 2005, from 65 to 66. And then after an 11-year hiatus, this transition from 66 to 67 will be complete by the end of 2022. So that's why if you fall into this range, if you were born after 1954, then this is why you're looking at these 66 plus 4 months, plus 6 months, plus 8 months, plus 10 months. After this year, we won't see that anymore, all right? So let's walk through this slide. The top graphic illustrates, the top graphic illustrates the what it would look like if you were born before 1954 or before, and that would mean that your full retirement age is 66. Delaying benefits results in a much higher benefit amount, and as you can see here, it's 132 if you're 70 and you waited from your full retirement age of 66. Okay. Likewise, if you took the benefits early, this is you would only get 75% of your full retirement account at 66.
Yeah. So if you took it at 62.
Oh, sorry. I'm sorry. Yes,
That's okay.
62. 62 is the earliest you can take it. 70 is the latest you can take it. Full retirement age is either 66 if 1954 or earlier, or it's 67 if you're born after 1960. Okay, so that's really important to understand, and we're going to go through this with different examples, but just knowing that the earlier you take it, you are, locking in, you're not getting that full benefit of full retirement age. So just be mindful of that. And then the second piece of this that I wanted to kind of point out for you is if you are if you're born 1960 or later than that, if you take the benefit early at age 62, it's going to penalize you more than it would if you were, in this age bracket with a full retirement age of 66. So just being kind of mindful of that you're not going to get as much of the benefit if you are over 1960 or were born after 1960. Oh, there's my animations. Another good thing about your benefit is that it's going to increase each year by what is called a cost of living adjustment. It's also called COLA. The SSA ties your benefit to the consumer price index for urban wage earners and clerical workers, and they call that the CPIW. Okay. You should make a clear distinction between the CPIW and the index that's quoted for inflation in the media, which is the CPI for all urban workers, or CPIU. That's a lot of details getting in the weeds. You probably don't care that much, but I think it's worth kind of distinguishing between those two. Regardless of the index, though, the key takeaway is that Social Security benefits increase to try and keep up with inflation. So that's what you want to keep in mind. And for this year, the cost of living adjustment is 5.9%. All right. Viva.
Hang on a second here. There we go. Believe it or not, you may owe taxes on a portion of your Social Security benefit. The amount that you may owe will depend on how much income you're receiving from other sources, such as wages, dividends, interest, and anything reported on your tax return as reportable income. The government has a percentage of benefit levels that are taxed depending on how you file, single, joint, married, but filing separately, and the amount of your combined income. And your combined income equals your adjusted gross income plus any non-taxable interest plus 1/2 of your Social Security benefit. The combined income thresholds amounts change yearly. You may request to have your federal income tax withheld from your monthly benefit. It's up to you to tell the administration how much to withhold for the current year's benefit. And one of the reasons we mention this is most people don't think you're going to get taxed on Social Security, but you could get taxed on every single dollar of Social Security if your other income is high enough.
All right. To finish out the specifics about Social Security and our conversation on this, and we're going to turn to Medicare, I wanted to take a look at 4 different Social Security strategies, and we're going to take a look at some examples. Please keep in mind, there are so many different types of Social Security strategies that can be utilized here, especially if you are in, specifically if you are in if you're married or you're in part of a couple. There's just a lot of different things. So these are just 4 things that you could be mindful of. So the first one is Spousal, the Spousal benefit. When you qualify for Social Security benefits after earning 40 credits, your spouse qualifies as well. Okay. The SSA will first look at your spouse's benefit record, which is based on their salary history. If this benefit amount equals less than 50% of your benefit, SSA will provide an increase to your spouse's benefits so that it equals 50% of your benefit amount. Okay. I keep seeing that the pop-up quiz. If your spouse's salary history results in a benefit to them that is greater than 50% of your benefit, then they would receive that benefit since it's higher. So no increase would be given from the program. Now, if we turn our attention to the widow or the widower's benefit, both you and your spouse also qualify for this benefit. If the benefit is less, if the widow or widower's benefit is less than the benefit of the deceased and the surviving spouse has reached their full retirement age, then the SSA will raise their survivor spouse's benefit so that it equals 100% of the decedent's benefit. Sorry, I always say that wrong. The decedent's benefit stops at that point, okay? So this is where it would stop. Like the spousal benefit, if your spouse's benefit based on their own salary history is higher than 100% of your benefit, then no increase is going to be given by the program. You should know also that if you remarry when you're age 60 or older and you were receiving a widow or widower's benefit, that benefit's going to continue. So nothing changes there. Moving on to for divorced spouses. If you are divorced and the marriage lasted for 10 years or longer, then a benefit is available to ex-spouses when they attain age 62 and remain unmarried. Now, this benefit works exactly the same as the spousal benefit worked in that the ex-spouse's benefit will increase to 50% of their ex-spouse's benefit. Okay, that's a mouthful. The benefit paid to an ex-spouse does not affect the amount payable to a new spouse if they remarry as a spousal benefit to a current spouse. So if if I get remarried, it's not going to impact, and my ex uses my benefit, it's not going to impact my now current spouse's ability to collect that benefit. So that's an important thing to understand. It has no impact on your marriage today. And then the last one, this one's a little bit more complicated to kind of go through, but we're going to walk through it. In this scenario, a couple at their full retirement age applies for benefits, utilizing both a spousal benefit and delayed payments. So in this scenario, the spouse with the lower Social Security benefit begins to receive their benefit based on their own salary record, okay? Because that amount is equal to or greater than 50% of the spouse with the higher full retirement benefit. The spouse with a higher Social Security benefit also delays receiving their benefits, allowing those credits on his or her benefit amount to accrue. However, at full retirement age, they still apply for a spousal benefit, which equals 50% of the lower Social Security spouse's benefit. When that spouse with the higher benefit reaches age 70, then they would apply for their own benefit. And that has been increasing through those delayed retirement credits. So they would shut off the spigot for taking the benefit on their spouse, and they would turn on the spigot at age 70 because they would get a higher amount. Only one spouse in a marriage may claim a spousal benefit and delay his or her own benefit until age 70. I know that's really complicated, and as you can see, there's a lot of different strategies to look at, especially when you're married. And we've only covered really a small sampling of what those strategies could be considered. But if you have any questions on this and you want to take a deeper dive into your own particular situation, please let us know. We'd be happy to set up time to go through it and take a deeper dive into this. It is complex. It's a lot to look at, but we're happy to sit with you if it applies to you. All right, so now we're going to turn it over to Aviva, and she's going to walk us through how to navigate Medicare and retirement planning.
Thanks, Holly. This chart illustrates the total Medicare-related healthcare costs experienced by today's 65-year-old with original Medicare and how those costs may increase over time. Costs include Medigap, which is a supplemental policy that covers copays and deductibles for Parts A and B. Medigap plans are standardized, and there was a Plan G being the most comprehensive available for most new beneficiaries. Part D is for prescription drugs, and prescription out-of-pocket expenses are also included. And average costs are around $479 a month or $57.40 per person annually. These costs are projected to more than triple over 30 years in today's dollars for three reasons. One is higher than average inflation for healthcare expenses. Two, increased use of the healthcare at older ages. And three, Medigap premiums that increase not only with inflation, but also due to increased age in most states. These costs do not include most long-term care expenses either. So I've probably now thrown all the alphabet soup at you. It was not to make you think that you know it all. We're going to get into each one, but I figured I'd lay the basics out there. In discussing the cost of Medicare, it's designed to have people who make more money pay more for their coverage. The standard monthly premium for Medicare Part B enrollees will be $170.10 per month. IRMA, which stands for the Income Related Monthly Adjustment Amount, is just there to say that Medicare rates are adjusted for your income. So good and bad, depending on your philosophy and politics. The fact that people who make more money are going to have to pay a little bit more for their health care in retirement. So Part A is really hospitalization, and there is no cost for most people. As of 2022, most people will pay about $250 a month for Part B and D, B being the medical expenses, D being prescription drugs. And if your income is under 91,000, you're at that $250 per month level for an individual. And if you're under 182 for a couple, you'll still be at that $250 per month per person. And this is based on your income 2 years prior. If your adjusted gross income is between 170 and just under 500,000, or joint income between 340 and just under 750, I'm just trying to give you a different example further down the page here. The additional premium for Part B and D would be $615. So you see, the more money you make, the more you pay for this stuff. When you're still working and making good money, it can get very expensive. This is just something to keep in mind, that the cost for you could be higher if you're still earning large income. And this doesn't include the cost of a supplemental Medicare plan. One question that often comes up as you're retiring is, should I take COBRA? We don't typically we don't really recommend taking COBRA when you're in retirement. COBRA and Medicare don't really mix. If you go on COBRA, it doesn't count as creditable coverage, your other plan from work. So if you're retired, you'd be penalized by the fact that at age 65, you're on Medicare, and the COBRA coverage would be considered secondary coverage. It becomes a very expensive way to supplement your Medicare unless your former employer is paying for it. If you have COBRA and don't sign up for Part B, then you could be responsible for 80% of the cost of the care. There are certain circumstances where you might want to use it as a stopgap if your spouse is already retired and you're not yet retirement age, and therefore maybe not eligible for Medicare.
So health savings accounts, these are high deductible health plans. If you have one and you or your spouse are contributing to it, you cannot be on Medicare. It's a great plan to use before retirement to pay for out-of-pocket medical expenses with pre-tax dollars, but you are in violation of the tax code if you've signed up for Medicare Part A or B and are contributing to an HSA. So an HSA, in fact, before retirement can still exist and continue to grow, or B, you just can't continue to contribute to it, okay?
Medicare often comes up constantly, especially once you've received your first AARP call or card. If you are retiring, you'll need to enroll in Medicare Part A and B. Beyond that, you'll have to choose which drug plan you're interested in, and that is called Part D. So this is the Medicare system. A and B are from the federal government, and you get your nice little Medicare card. Most people sign up for Part A when they turn 65. There's no cost. You can go to the socialsecurity.gov website to sign up. You go to the drop down in the middle column, it says Medicare. You scroll down to apply for Medicare benefits only, because assuming you're not really ready to get the Social Security payments, and you sign up. If you're working, there's no harm in having it if you're not in an HSA, as Holly just mentioned. There's no premium for Part A. But if you're covered under your work health plan, there's also not much advantage or anything you'll get from it either. Making a switch to the federal plan means you should sign up for Part B as well and no longer remain on your corporate plan. Everything below the bar, so it says 2 there, is a private carrier using to pay for things that Medicare doesn't cover. AARP, for example, has plans in all 3 boxes. Tufts also has a plan, but they don't include drugs, so you'd have to get those from a separate carrier. There's no real advantage to having both coverages with the same carrier, but it's your choice. Also, because these are individual plans, there's also no real reason that you and your spouse need to be on the same plan. It just may make it easier from a bill payment perspective. And it depends on what your needs are for your health situation, because everyone gets to retirement, they may have very different health needs. Now let's get into Medicare. This is Part A and B. Part A, as I mentioned before, is hospital. The easiest way to think about it is care in a hospital. And these are updated for 2022. Although there's no premium, your first night in the hospital can cost you up to $1,556, which is the deductible. And that covers you for the first 60 days. From day 61 to 90, there's a per diem or per day cost of $389 a day. Days 91 to 150 are catastrophic days. Once you've used those up, there is no more coverage. It covers, so Medicare Part A covers care for rehabilitation as well when you're improving and expect to go home. And then they cover it for the first 20 days with a $194.50 copay from days 21 to 100. After day 100, it also ends, and you must maintain a progression in your recovery to even sustain it to day 100. Rehab itself must follow a 3-day hospital stay in order to pay you that coverage. So going into a rehab facility or getting rehabilitation care. And that's key because a lot of hospitals observe you for a day and then send you home. And then you'll be penalized because if you're going to a rehab after that or need to go to rehab, you won't qualify for coverage because you didn't follow a 3-day hospital stay. So it's important that you advocate on your own behalf or a family member when you're at that stage and age to make sure that they keep you a full 3 days for observation or whatever if you want Medicare to pay for that type of thing. Part B covers everything else, medically that's speaking. It has a very low annual deductible of $233 and covers really any other medical expenses. Compared to group plans, this is usually very inexpensive. It works a lot like the old Blue Cross plans where 80% is paid for medical expenses and you pay 20%. Unlike group plans, there's no cap and no lifetime cap, which is why many people look to supplemental plans to limit that exposure. So this is the Medicare system. A and B from the federal government at no cost for Part A and about $170 per person per month for an individual, obviously adjusted for income per that slide that we showed earlier. Then there are supplemental plans that vary in Massachusetts, but our system is very different from the rest of the country. There's a core supplement, which is the same across all providers from Blue Cross to Tufts to Fallon, et cetera. The carrier is irrelevant from a standpoint of that as the state dictates the terms of those contracts. Drug plans differ from carrier to carrier, and they don't have to be the same carrier. So you could have one, your spouse could have another. And once again, the reason for that is that you may be on certain drugs that one considers a more expensive drug and another plan says, no, those are pretty average standard drugs and we subsidize those. So basically you really need to do the research. Typically drug plans range from or Part D plans from $8 a month to $130. And it depends on where you live, what drugs you take, where you get your prescriptions. With these supplemental plans, you're typically at around $370 per person per month. Then there's what's called an Advantage plan. With an Advantage plan, you're replacing the coverage up above. So that Part 1 coverage, it's kind of stepping in to that whole piece. There's no standalone drug plan. Now you're getting it all from one carrier. And the difference is that it's an HMO type plan. You get everything from one place. Drugs are typically cheaper from Advantage plans. Other advantage to Advantage plans is that they cover the extras. We'll talk about that in a minute. Medicare plans have no dental, no hearing aids, no vision, fitness, etc., whereas Advantage plans cover these extras. There really is no right or wrong. It just depends on your needs. And in Massachusetts, it's very easy to move back and forth between these types of plans. So let's talk about the pros and cons of some of these things. The pros on a Medicare supplement, option 1, you pay a fixed monthly cost, which will be about $200 per month, and there are no copays, no networks. The cons are that there's a fixed annual cost of about $2,400 whether you used it or not, no vision, no dental, and it requires a standalone drug plan. If you don't use medical services much, then the Advantage plan might be better because you don't have that fixed annual cost. With an Advantage plan, there is no monthly cost, no deductible, but it has these ancillary benefits that many of us are used to during our working years. It does have copays when you use the plan, and there are network restrictions if you're in an HMO or PPO. So there's sort of in-network costs and mostly out of network is where you have the bigger costs. It has a higher out-of-pocket maximum of $7,500. And there are lower out-of-pocket maximums with different providers, so it really depends on your specific circumstances. So which do you choose? You can change back and forth in Massachusetts, as I mentioned before. You're not locked in from one to the other. If your health declines, though, it might be harder to go from an Advantage plan to the supplemental plan, which would have been the better choice if you have a lot more medical expenses. So it's hard to say, and unless we know your own specific situation, you really do want to spend some time thinking about this. Annual enrollment is often is October 15th to December 7th. If you have an Advantage plan, you have from January to March 31st to enroll. You have 3 months before you turn 65 and 3 months after you turn 65 to enroll in these types of plans. And by the way, 65, so the medical system is, even with Social Security, is still based in the 65 retirement age, whereas the retirement benefit that Holly mentioned the first half starts at 66 or 67. Don't ask me why they're not truing these things up. And they probably will get there, but it'll be delayed. So there are lots of different timeframes where we'd suggest, as you're nearing retirement, to look and consult with someone on the whole Medicare election situation. We covered a lot of the different types of medical plans without getting into too many of the specifics, but this is an area where your own medical situation and needs really do have an impact on the best option for you. We can connect you with our consultants who can discuss your personal situation and advise you accordingly. So, want to summarize? Were there questions that came up?
There are a few, but I think we're closing at the end here, so I think we can just hold off and we'll ask them all at the end. We'll go through them at the end.
Perfect. Do you want
Yeah,
to summarize?
Sure. I'll do the Social Security one. You can do the Medicare one.
All right, fine.
So Social Security is funded by the taxation of wages. That's kind of an important fact to keep in mind. And as you are nearing retirement, you want to be thinking about when to begin taking Social Security and what type of government health plan is best for you. You're going to want to read your statement, get to know what your full retirement age is. If you're, especially if you are in that in-between stage of, and this is the last year again that'll be happening in between 1954 and 1960, I think. You get less if you activate before full retirement age. So if you decide to take the benefit at age 62, you're going to activate that and you're going to lock in that lower rate, which might be the right decision for you, but you just want to make sure that you're aware of all the different situations or scenarios. The benefits are going to increase by a cost of living adjustment, though it's not guaranteed from year to year. We have seen it quite a bit, but as you saw in that slide, 2016, there was no adjustment. So it is possible to not have one. And then lastly, on Social Security, it's not meant to replace all of your income during retirement. But if making other income, your Social Security benefit will be taxed. Okay, so that's a really important thing. 30, 40, 50 years ago, Social Security was a big piece of retirement for folks. And, we have shifted that practice. And now it is, it's a piece of it. It's an important piece, but it's only one piece of it. So make sure that you are keeping that in mind when you are doing that future planning for retirement and other long-term goals, because it is beneficial.
And as far as Medicare, I think the first bullet point says it best. It's complicated. You should be thankful for your HR folks where you're working now, because they do an awful lot to cull through one plan versus another, which things to offer, which things not. When you get to your own retirement, you have to start looking at all this stuff. It can make your head spin. But it should be considered, and you should start thinking about it as you reach your mid 60s, or if you think you're going to be retiring. It's typically less expensive than what you're paying now for your corporate health plans, even oftentimes similar to what you're paying it, because usually the corporations subsidize a good chunk of it. And but we would say, for the most part, when we talk to folks who have some means, supplemental plans are usually worthwhile, mainly because of that, the annual cap and a lifetime cap that you have with insured plans versus the exposure you have with Medicare, where you don't really have those caps for your own out-of-pocket costs. The type of plan should be chosen to meet your specific medical needs, and it could very well be different than what your spouse needs. So, and there's no, unlike a corporate plan, there's no advantage being in the same plan. So that you do want to look in terms of just the fact that you're sending a check maybe to one place for two of you. Aside from that, if you've got a spouse who has more medical needs or fewer medical needs than you do, it's important to look at those plans closely to see what's going to fit your budget best. It's either you pay a little bit more as you go and maybe a little less out of pocket later on, or if you're generally very healthy, you pay less up front and maybe more if you have an emergency. But either way, there are things that are capped, and if you have one of those advantage or supplemental plans, you'll be in good shape. And then drug plans, they vary by carrier and really should be strategically chosen. Fortunately, I am not on a lot of drugs, so it's never been an issue for me, but I have plenty of clients, patients, friends, whatever you want to call them, that I know are on all different types of meds, from statins to who knows what. And depending on what you normally subscribe to, it's a huge financial difference looking and scrutinizing and finding the right plan, because what one carrier says is a pretty standard plan, or if you take generic of something and the other's full-fledged, whatever the original iteration of that drug was, those can be treated very differently cost-wise among the different plans. So as you're nearing retirement, you want to be thinking about when to begin taking Social Security and what type of government health plan is best for you. Though they may not seem directly related, which health plan you choose and how much it costs may affect your income needs in retirement. If you have other resources to pay these costs, as well as other living costs or costs of living, deferring your Social Security might make sense. However, if you don't have endless funds or other ways to get income, you may need Social Security payments to help pay for Medicare. So they actually are related in some crazy way, not that we just wanted to lump two subjects together to talk about. So with that, I think we should open it up for some questions.
We did have a question in the chat box,
Okay.
Aviva or Holly. Someone just wanted to confirm that they heard this correctly, that once you're on Medicare, you can't add to an HSA. And then does that mean you can't use the money that's already in the account?
So I maybe didn't make that as clear as I should have. You can keep your HSA, absolutely. You can take money out of your HSA to pay bills when you're at that stage. You just can't add to it. You can't make further contributions to it.
I had a couple more questions come through. So one was, will you share the slides after the presentation, or is it recorded? So yes, absolutely. We turn these into videos and they are stored on our channel, and you'll get a notification of that after the presentation. Another question I got, if I want to take Social Security starting this August, when should I apply or start the paperwork?
The answer to that, I think, has more to do with how old you are, and if you're turning 65, or if there's a separation from service. But those types of questions are somewhat specific to the individual circumstances. Any other questions, thoughts, comments? Anyone been through this? I will say one thing. Many people, I think my aunt was one of them, who was very hesitant to get off our health plan at the company and to go on Medicare. It sounded like some bad, scary word, because a friend of hers had some problems with claims and other things. That person probably would have had those same issues with claims where she's still on a corporate plan too. Medicare pays just as well, if not better, than most of our insured plans that we have through work. And it is cheaper, and it actually could have saved her a lot of money along the way out of her own pocket, not to mention what we were subsidizing from the company to cover her expenses. So 2 parts of it. One, it's expensive for the company to keep you on when you can get a plan that you basically have already had pay for out of the Social Security payments you made for Medicare, FICA, all that stuff that's taken out of your paycheck every month, every paycheck. That's to help pay for that health plan in retirement. And at least at the moment, until we have a national health care plan for everybody, there's no reason not to take advantage of it. But you do need to do the math. Look at a supplemental plan if you want to have the same kinds of benefits you typically get through work. Medicare Part A and B might not give you quite the same coverage without a supplemental plan or the Advantage plan. Any other questions? We might get to end early. Hey, Holly, I have a question for you.
Okay.
In saving for retirement, does it matter whether you do it on a Roth basis, like through your 401k or 403b, versus a pre-tax basis when it comes time to take the money out in retirement?
Such a good question, Aviva. One thing to keep in mind when you're talking about pre-tax versus Roth, the only difference really between these two is when you pay your taxes. Uncle Sam's still going to get his money, but it's just about when they're going to get it, right? So when people ask us like, well, should I do pre-tax? Should I do Roth? Should I do both? And when? It's like, I don't know. It kind of really depends on you and what you want. My first question always is, well, it depends on whether or not, do you think taxes are going to be cheaper or more expensive when you're retired? And if you know the answer to that, then this is a really easy question to answer. Since we don't know that, we kind of have to plan for both, right? So that's when we're talking with clients and based on what their needs are, we're trying to figure out like, okay, from a tax efficiency perspective, what makes the most sense today and tomorrow when we take that money out. So we're looking at both sides of the accumulation phase of retirement or saving for retirement and the distribution phase. So it depends is my answer. I know that's not a clean, fun answer, but it kind of depends.
And I would add to that,
Yeah.
that in looking at your investments for retirement, oftentimes we try, you follow a diversification strategy where you want to spread the money around in different types of investments. Spreading it around in different types of taxable buckets or non-taxable buckets in retirement is another strategy people should think about. Because as I mentioned and Holly mentioned, when you're in retirement, Social Security payments will be taxed at whatever your income tax rate is. So if you're in a higher tax bracket in retirement or a high tax bracket in retirement, Social Security is only going to add to that taxable income. But if you had a tax-free bucket to pull from, so a Roth bucket in retirement, you could potentially take some of your income from that to keep you in a slightly lower tax bracket for your taxable income. And people don't really think about this, but given the amount of federal deficit that we are now in, with all the money that was put in for sustaining the economy during COVID and the pandemic, I think we're not going to see tax rates go down anytime soon. So those of us who are at the other end of the spectrum, where retirement is on the horizon, at least the retirement age is on the horizon, even though we may not retire, it does pay to think about diversifying your pre-retirement savings into some pre-tax and some post-tax buckets.
Yeah.
I could add to that too, real quick, is just a little story. I had a client, older client who saved his whole life, made a lot of money. His retirement 401k rollovers were the tune of close to $2 million. And just as Aviva described, he never did any Roth saving. So all of his required minimum distribution, he put it off, taking out of those accounts till he was 70 and a half. And they were That's added income that he had to take along with his social securities that he had to take and all his taxable. So I think we would say now, if you were looking at planning, definitely have some Roth buckets to pull from, so you have a choice. So it's not all in one huge IRA rollover type situation.
Yeah, and last thing I'll add to that, but when we're talking about diversification, if you are part of an employer plan, just understand that any employer match dollars that they put into your account will always go into a pre-tax bucket. So, you know, that might be part of your strategy as well when you're talking about diversification, just a little bit differently.
For sure.
Good. I saw there was another question from Jude. Is there anything that is being proposed in Washington that could impact this retirement planning? There are always things being proposed in Washington to impact our retirement planning. I think daily there are bulletins, hey, we might try and tax your retirement plan, even the Roth ones. They're going to keep pushing for those types of things. But I would say right now you have to operate under the rules in place now are kind of the rules that we should be living by and thinking by. That chances are they may grandfather something after a certain period of time. If they ever change those types of rules, they typically, not always, but they typically grandfather people who followed the rules in place at the time with all intent to follow whatever that path was. The other nice thing about Roths are there are no required minimum distributions at the back end because the government got their tax money up front. So if you aren't going to need the money for quite some time and don't think you will, it's not a bad place to be considering.
And just kind of piggybacking about that, as far as legislation is concerned and Social Security, I didn't take a deep dive into it because I mean, I geek out to it, but maybe not everybody else does. But there's a bill, Know Your Social Security bill, is in Congress right now. I think it's been in there for a couple of years, but basically, the statements that we used to get consistently, that is part of the law. Everyone should be getting it. And for whatever reason, they just collectively stopped sending them out. It's not a terrible deal if you know to go to ssa.gov and you can figure out how to get online and get your own statement, fantastic. But if you don't know that, the problem then becomes, well, if you're not seeing a statement, then you have, the first time you see it is right before retirement. If there's any errors along the way, it's hard to identify where those happened and how to fix them. And that could impact your benefit amount in retirement. So, you know, just being mindful of that. And if you get nothing else out of today, go to ssa.gov and make sure that you have access to your statement.
Hey, Holly, someone asked in the chat as well, and we should bring it up. Can we bring up the poll and let's at least go through the questions because we never
Absolutely
took people through that.
Yeah, so Allison mentioned that she thinks the reason is if everybody doesn't have the latest version, but I don't,
Let's just bring them up. It doesn't matter if they get them right. We can show the answer. We can do a show of hands too. Well,
Right.
For those who are showing their faces, if they want. I mean, listen, even after preparing for this, I think I got a couple of them wrong, so don't feel bad.
Yeah.
All right, so the first question, at what age would you receive the maximum benefit from initiating Social Security? And your choices are age 62, your full retirement age, which is either 66 or 67 or somewhere in between, age 70 or 72. How many of you think 62 would give you the max? All right, normal retirement age or full retirement, 66 or 67.
That's what I said.
How about 70? And 72 doesn't, I mean, you can't wait till 72.
There's no benefit for you to wait after 70. No
Right.
increased benefit.
And just as an aside, one of the trade-offs there is that when you defer, now at normal retirement age, moving from 65 to 70, that's a 5-year difference. And for most of us, it's going to be only 67 to 70. So it's not that big a difference. The question is, if you don't live long enough, and we'll have this as in our resources afterwards, if you happen to die early, starting late, didn't give you as many payments. It may have been bigger payments, but you didn't get as many of them. So that's kind of one of the trade-offs of delaying. So you have to sort of think through whether you're healthy, whether there's longevity, and a bunch of other things. All right, question number 2. For non-disabled people, what is the earliest age you can receive a survivor's benefit? 60, 62, full retirement age, or 70? How many of you say 60? How many 62?
That's what I said.
How about full retirement age, 66 or 67? This is when non-disabled, or your average person, can receive a survivor benefit. And 70. Okay. The correct answer, drum roll please, 60. You can actually get it as early as 60 if you're to receive as a survivor's benefit. So if your spouse passed away. To qualify for spousal benefits, does your spouse need to be receiving their benefit? How many say, if you think the answer is yes, raise your hand. If you think the answer is no, don't. And if you don't know, you can just do one of these. Okay.
So yes, raise your hand. No, raise your hand.
All right. So the correct answer for that is to qualify for a spousal benefit, your spouse does need to be receiving their benefit. Okay. And then can divorced spouses receive survivor benefits? Either yes, no, or I don't know.
Yes. Yes.
We get a yes. Holly, what's the answer?
The answer is yes. Yes, you can. The criteria differs slightly than for married spouses. For example, the marriage must have lasted for at least 10 years. And there are some other rules around remarriage, but divorced spouses can collect. Are we talking divorced
No,
spouses?
number 4.
Oh, sorry. I must
Yeah,
have talked-
can divorced spouses receive survivor benefits?
Yes, right. So again, divorced spouses can collect survivor benefits in relation to a deceased ex-spouse. So yes, but there's a few caveats around that. And one being you have to have been married for 10 years.
Right. And then can divorced spouses receive spousal benefits? Yes, no, or I don't know. So you can do a thumbs up, thumbs down, or a no idea here in the middle. Can a divorced spouse receive spousal benefits? So an X.
I think yes, but
So you
if
give me a
they-
thumbs up. Anyone for a thumbs down? I can't see my thumb. Anyone for a thumbs down? Anyone for a not sure? All right, the answer is yes. Divorced spouses can receive spousal benefits. I think those were the questions that we had at the beginning. So
That was it.
clearly we didn't cover them all yet because they would have had the answers at the end. So, well, it's complicated stuff. And there's always the it depends, depending on the situation.
That's the
and-
hard part, I think, for folks is that there's so many outlying situations that you really kind of have to dig a little deep.
Yeah.
There are some questions here. Let's see. Who's my moderator? Monitor. What is a survivor benefit?
Oh, that's a good question.
That's
Sorry.
a great question, Daphne.
You want to give that an answer, Holly?
Sure. So the survivor benefit, this is if I passed away, then my children or my spouse would be eligible for survivor benefits. So that's what that means. That I could go into a deeper explanation, but that's essentially what it means.
Yeah.
Have you-
Sorry for assuming people understood that.
Yeah.
But a survivor is someone who survives the deceased. It's a family member, relative, spouse. Any other questions?
There's a
Yeah.
couple more in the chat, but so what happens if if there's no spouse survivor and there's kids, does it go to their issue?
Right.
Yes.
Say that
I mean,
again.
the will, it's all in the will and everything else, in terms of spelled out, in terms of any of that. That's what I glean, but just verifying. Or can they give it to others? I guess it's that spelled out.
You cannot, I don't know that you can leave your social security benefit to others. They have to be family members. So if you're no longer married or your spouse predeceased you, it would go to your children.
Yeah.
Unlike an insurance policy, we can leave different beneficiaries. It does not quite work that way, to the best of my knowledge. Anything else?
can I ask about the Advantage plan?
Yeah.
You mentioned that if you need to have something, I'm not quite sure, you said the advantage, you may want to have the supplemental plan versus the Advantage plan. Because that doesn't offer.
If you have a lot of medical expenses or the potential for a lot of medical expenses because of some of the limits and the cap is lower typically on the single supplement plan. The Advantage plan has more flexibility, more perks, but it is going to cost you a little bit more if you have a lot of medical issues. So the supplement would be potentially a better choice than the Advantage. But it really depends on your family history. It depends on a whole bunch of different things. I mean, I don't want to just sort of answer it on one foot or on one cheek.
Okay, thank you.
And this, if you want, when you get the slides, you can certainly take a look and see what's written there. And if you have more questions, to give us a holler. And we do have consultants as well who can chat with you about your own personal situation.
And there was one more question about what if an ex-spouse is remarried, can you still collect? So yes, when it comes to ex-spouse benefits, Social Security doesn't really care about the marital status of your former spouse. It only cares about your marital status. So you would be all set.
Was that the question? I'm not sure I understood.
What about
from
if the ex-spouse is married? Can you collect Social Security if your ex-spouse has remarried?
Yes, and you're the ex-spouse who was the one whose Social Security benefit. Yeah, you're still collecting your Social Security benefit.
Yeah.
Correct. A lot of X's. When Holly and I were writing up our thoughts here, we were kept ex-spousing and spousing and ex-spousing and the former spouse and getting ex-spouse benefits. The whole thing was driving us crazy. We had to try and come up with some language that we felt wouldn't confuse the heck out of us and you.
Yeah.
Yes, Jude.
Well, that was my question, because if you are that ex and you haven't been working, and when you were whatever domestic, engineer you were in your life with that spouse, let's just say, then do you still continue to get, proceeds from that relationship, even though you're not married to that person anymore?
As long as you were married for 10 years, yes.
No, great. Thank you for clarifying. Yeah.
You're all set, hon.
Thank you. I'm not worried about me. I'm worried about all my people. Oh my God.
I know. I just had to make a little funny.
Woo-wee.
Yeah. Any other questions here? Well, we thank you for your participation today. And if you were on any of our others as well, when Womenology launched for all of these things that have women helping women, we did some financial education sessions, and we had to cater to audiences that were pretty broad, that had all sorts of different needs. And so that was why we created these Women Getting Wise About Wealth specific deeper dives into very unique or specific topics. And we are happy to re-engage and start some new things. So when you get your survey, if there are topics you think you'd love to learn more about, or you didn't feel we went deep enough, please let us know, and we'll do our best to start the next round with more information on different topics. And we appreciate your time and continue to learn. We're women, we're a neighborhood, we're here to help each other. So.